Welcome to the Deep Dive. Today, we're plunging into a topic that, well, while often unspoken, has pretty profound implications across the animal kingdom. Infertility.
Hmm.
We typically think of it in human terms, right? But it's actually this massive sort of silent challenge affecting everything from livestock productivity to the delicate balance of wild ecosystems.
It really is a huge hidden factor.
Okay, so let's unpack this. Our specific focus today is infertility in two fascinating groups.
Hmm.
Camelidae, that's your camels, llamas, alpacas, and Cervidae, the deer family.
Right. Two very different groups in some ways.
Exactly. And we've pulled together a stack of insightful sources that reveal a truly complex web of causes and, implications. It's going to be a real deep dive into the hidden factors affecting these animals' ability to reproduce.
And our mission for you, the listener, is to really help you extract the most important nuggets of knowledge from all this. We want you to quickly grasp the multifaceted nature of these reproductive challenges.
Yeah, maybe with some surprising facts and practical insights along the way.
Exactly. The goal is moving beyond just what's happening to really understanding why it matters for the animals and importantly for us too.
Absolutely. So let's kick things off with our first group, Camelidae. For camels, llamas, alpacas, infertility isn't just a biological hurdle. Our sources really highlight it as a primary source of economic loss.
Oh, definitely. A huge economic driver, or rather, a loss driver.
Think about it. These animals are crucial. Transport, milk, meat, wool in so many regions. When they can't reproduce effectively, it hits livelihoods hard.
Directly. And what's fascinating here is the sheer diversity of causes behind this. It's not just one thing.
So how do the sources break it down?
Well, we can broadly categorize them, sort of put them in boxes,
Yeah.
pathological, management-related, functional, and congenital disorders.
Okay.
And each category brings its own set of challenges, often tangling up together, making diagnoses, a real puzzle sometimes.
Right. So digging into female camel infertility first,
Mhm.
what are our sources pointing to as the biggest concerns? Are there specific infections that keep popping up?
Indeed. Pathological and infectious causes are consistently a leading factor. We're talking serious uterine infections, things like endometritis, that's inflammation, or pyometra, which is pus accumulating.
Nasty stuff.
Very. And common bacterial culprits are often involved, like E. coli, staph, strep. It just reminds us how even seemingly simple infections can derail reproduction.
And it's not just infections inside the uterus.
No, beyond that, we also see problems like ovarian hydrobursitis fluid buildup around the ovary, or even physical adhesions like scar tissue in the vagina or cervix.
Ah, so a physical blockage.
Exactly. These can literally prevent conception, and unfortunately, the prognosis often isn't great when that happens.
It sounds like a lot of potential biological pitfalls. But you mentioned management, too. It's not just disease, right?
That's a crucial point. Management, human factors play a huge role. Well, our sources point to things like inadequate managerial experience, maybe not enough herders per camel, or just sticking to traditional systems that aren't really optimized for fertility. These can seriously drag down reproductive efficiency.
Okay, so practical husbandry matters a lot.
Immensely. And then you have functional disorders, things like the ovaries just not being active, or follicles growing too large but not ovulating, or ovulation failure.
And what drives those functional issues?
Often it's linked back to a familiar culprit, poor nutrition, especially deficiencies in key micronutrients. We're talking selenium, iodine, vitamin A or E, all critical for reproductive health.
Got it. And I imagine some issues are just there from birth. Congenital problems.
Yes, exactly. Congenital defects can also cause permanent infertility in females. Less common maybe, but they happen. Things like an ovary just not developing ovarian agenesis, or anatomical oddity is like a double cervix.
Wow. So when we pull all these threads together for the females, it's really just one simple issue, is it?
Almost never. A consistent finding across the sources is the importance of hormonal issues too, like luteal insufficiency, not enough progesterone to maintain a potential pregnancy.
Right. Progesterone's key.
Vital. We also see irregular cycles anestrus, which is no heat, or silent heats where the signs are missed by the handlers.
Tricky to manage.
Very. Then anatomically, as we touched on, underdevelopment or malformation of the uterus or cervix. And that whole microbial world, bacteria like Brucella, chlamydia, mycoplasma, viruses like BVDV, even protozoa like toxoplasma. It's a complex infectious landscape.
Okay. That paints a pretty detailed picture for female camels. But what about the males? Are their fertility challenges just as complex?
They are, absolutely. And our sources suggest they often show up in Well, maybe three main ways.
All right, let's hear them.
First, there's something called postcoital infertility. Sounds a bit strange, right?
Yeah, mating happens, but no pregnancy.
Exactly. The mating occurs, but conception fails. And the sources say this is actually the most common issue in males. It's often linked back to the testes degeneration, problems with sperm production, or just poor semen quality overall.
And what causes those testicular issues?
Interestingly, oxidative stress seems to be a big factor. And again, those key nutritional deficiencies pop up, especially zinc and selenium.
Zinc and selenium again. Okay, what's the second way male infertility shows up?
The second is a more obvious one: inability to copulate. Just physical issues preventing the act itself.
Like what kind of physical issues?
I think conditions like phimosis, where the male literally can't protrude the penis, or various injuries, traumas, even tumors affecting the penis or prepuce.
And how do those happen?
Well, believe it or not, the sources mention the aggressive nature of camel mating can contribute, plus transport injuries. These can definitely worsen physical problems. And even erectile dysfunction can be a factor, sometimes linked to, surprisingly, cardiac health markers.
Ah, heart health affecting mating ability. Interesting. Okay, what's a third category?
The third is rarer: a lack of sexual desire or low libido.
And what causes that?
It can stem from hormonal imbalances, certainly, but also things like high environmental temperatures, chronic stress, or other debilitating diseases that just drain the animal's energy and drive. Even management practices like confinement can shorten their natural rutting period, impacting desire.
So stress and environment play a role there too.
Definitely. And just like the females, males aren't immune to infectious threats impacting fertility.
What kind of infections are we talking about for males?
Significant pathogens like the blood parasite Trypanosoma evansi,
Yeah,
that one can cause testicular lesions and actually reduce testosterone levels.
correctly hitting the hormones.
Exactly. Other diseases like TB can compromise reproductive ability too. And then there's a whole list of pathogens found in semen samples from infertile males: Mycoplasma, Leptospira, Brucella, even BVDV again. Shows you need thorough testing.
Okay, so given this incredibly wide range of causes in both males and females, how do vets even begin to diagnose and treat infertility in camelids? Sounds like a massive challenge.
It really is, which is why pinpointing the specific cause is so critical. You can't just guess.
So what does diagnosis involve typically?
Usually a combination of things: a thorough reproductive history from the owner or herder, a hands-on physical examination, hormonal testing, checking those progesterone and estrogen levels, and lab tests for all those infectious agents we've mentioned.
Right.
Sometimes an endometrial biopsy, taking a small sample from the uterine lining, is needed to really assess uterine health.
And treatment options, do they mirror the causes?
Pretty much. It could involve hormonal therapy, antibiotics if bacteria are the culprit, sometimes surgical intervention for physical issues, definitely nutritional supplementation, and crucially, making changes to management practices.
And what's the outlook, the prognosis?
It really varies. It can be quite good for, say, straightforward hormonal issues or problems fixed by better management, but it's often more guarded, more uncertain for chronic infections or significant anatomical defects that maybe can't be fully repaired.
That makes sense. Okay, that's a really comprehensive look at the camelids, where infertility hits the wallet, essentially. Now, let's switch gears and transition to Cervidae, the deer species.
Right, a very different context.
Exactly. Here, fertility rates aren't primarily about direct economic loss in the same way. Instead, they're a key driver of ecological dynamics. The health and reproductive success of a deer population directly shapes its environment.
And environmental conditions, nutrition, infectious diseases, they all heavily influence those crucial fertility rates in the wild.
So this raises that important question you posed earlier. How do the causes of infertility in deer differ, or maybe overlap, with what we just discussed in camelids, given we're moving from managed systems to often wild populations?
Yeah, the context shift is key.
Let's dive into female deer infertility first. What are the big players here according to our sources?
Nutrition and environment are absolutely critical, perhaps even more directly visible than in managed camels sometimes.
How so?
A doe's nutritional status is just fundamentally linked to her reproductive success. The sources emphasize this threshold body weight she needs to reach a certain condition just to ovulate and conceive successfully.
So poor habitat or too many deer.
Exactly. Poor habitat quality or high population density leading to overbrowsing and competition that causes nutritional stress. And the result, it can delay puberty in young females or just reduce fertility rates in adults.
And what about other environmental factors?
A big concern highlighted in the sources is environmental contaminants, things like heavy metals, pesticides, these endocrine disrupting chemicals.
Oh, hormone scramblers.
Precisely. They essentially mess with the animal's natural hormone signals, disrupting the whole reproductive system.
Okay, so nutrition and contaminants are big environmental factors. What about their own physiology?
Right, there are physiological and age-related factors too. Deer are seasonal breeders, typically short-day breeders. Their reproduction is tightly timed by photoperiod, the day length.
To ensure fawns are born at the right time, presumably.
Exactly, when food is most plentiful in spring. And just like many species, including humans, fertility does decline naturally in very old females. That's reproductive senescence.
Do infectious diseases play a big role in deer infertility too?
They certainly can. Bovine brucellosis is a notable one, Brucella abortus. It can actually spill over from cattle populations into wild deer, causing infertility and abortions.
A cross-species issue.
Yes, and other agents like Leptospira and Campylobacter are also documented. Hormonal issues, like an estrus lack of cycling, either seasonal or due to poor nutrition and luteal dysfunctions similar to camels, are observed.
Any anatomical issues?
Yes, reproductive tract abnormalities can occur, underdeveloped tracts, obstructions, that sort of thing, though they can be harder to diagnose definitively in wild, free-ranging animals.
Right, you can't just bring a wild deer in for a checkup easily.
Not usually, no.
But here's where it gets really interesting with deer and quite different from the camelid situation. Fertility control as a management tool.
Ah, yes, this is a major point of divergence.
In areas where deer populations are considered too high, causing ecological damage or human conflicts, fertility is sometimes intentionally suppressed.
Right, using things like immunocontraceptive vaccines. Gonacon is one well-known example.
How do those work?
They target a key reproductive hormone, GnRH, gonadotropin-releasing hormone. By creating an immune response against GnRH, the vaccine effectively shuts down the reproductive cascade, inducing infertility in the does.
So managing populations without culling.
That's the goal, yes. A non-lethal management strategy.
Fascinating.
Yeah.
Now, let's shift to male deer infertility. Is nutrition as critical for the bucks and stags?
Absolutely. Very similar story to the females. Male fertility is tightly linked to nutrition. Malnutrition may be from overgrazing in those overpopulated areas.
Leads to problems.
Yes, it can cause delayed sexual maturity, hypogonadism basically, underperforming tests, and even abnormal antler development in young males.
Antler development, how's that linked?
Well, antler growth is heavily influenced by testosterone. So poor antler development can actually be an outward sign of underlying health issues, potentially including reproductive problems. It's like an indicator.
Interesting. What about genetics or other environmental factors for males?
Genetics can play a role. For instance, hybridization between closely related deer species sometimes results in sterile male offspring.
Okay.
And environmentally, there are observations in some populations of genital abnormalities, things like misaligned scrota or ectopic tests, which some research suggests might be linked to those endocrine-disrupting pesticides we mentioned earlier. Still an area of active research.
And what's really fascinating here, mirroring the females, is the use of induced infertility in males, too.
That's right. Those same GnRH vaccines used on does, they work on males as well.
What effect do they have on the bucks?
Administering the vaccine leads to gonadal atrophy. The testes shrink, a significant loss of sexual interest or libido, and altered antler development, often resulting in antlers staying in velvet or being shed abnormally.
So it's like a temporary reversible castration.
Essentially, yes. A non-surgical approach to controlling male reproductive contribution and related behaviors used for population management.
So for cervidae, with these often wild populations, how does diagnosis and treatment work? It must be different.
The tools are similar, but the application is often different. We'd ideally rely on reproductive history if known, physical exams if feasible, hormonal tests, lab tests for infections, maybe ultrasound.
But getting those samples or doing exams is the hard part.
Exactly. Treatment-wise, hormonal therapy or antibiotics might be used in specific managed situations like deer farms, maybe nutritional supplementation in targeted cases, but surgical intervention, very rare in wild settings.
So the focus shifts.
It does. For wild deer, the emphasis often moves towards broader management changes, improving habitat quality to boost nutrition naturally, reducing population density to lesser stress and competition, and employing those population-level fertility control methods, like the vaccines, where appropriate.
And prognosis.
Similar logic applies. Generally better for nutritional or hormonal issues if they can be addressed, often through habitat management, but much more complex for anatomical problems or widespread chronic infections in a wild population.
That's a huge amount of detail on both groups. It really paints a vivid picture. So, stepping back now, what does this all mean when we bring Camelidae and Cervidae together? How do these deep dives connect?
Yeah, if we connect this to the bigger picture, we start seeing some really fascinating common threads, despite the obvious differences.
Like what?
Well, shared hormonal challenges, things like luteal insufficiency, irregular cycles, these fundamental issues pop up in both groups.
Okay, hormonal similarities. What else?
Shared pathogens, too. It's striking how many infectious agents like BVDV, Toxoplasma, Neospora appear as concerns in both camels and deer. It underscores how some disease agents are quite versatile.
Right, they don't just stick to one type of animal.
Not at all. And critically, those environmental and management similarities, nutritional deficiencies and stress, whether from poor pasture, overcrowding, or handling, significantly impact fertility across the board. These seem like universal pressures.
But despite those common threads, the implications are really distinct, aren't they?
Absolutely. That's the key contrast. For camelids, as we said, infertility translates pretty directly into economic loss. It affects human livelihoods, transport, food security in some regions.
Whereas for deer,
For deer, fertility rates drive ecological consequences. Population dynamics, impact on vegetation, predator-prey relationships, overall ecosystem health. One is primarily economic, the other primarily ecological.
and this raises that important question about management, right? How does this difference shape how we intervene?
Precisely. Our understanding of these different consequences leads to very different strategies. For a valuable individual camel, you might see intensive individual veterinary care, hormones, surgery, whatever it takes.
But for a large deer herd causing problems.
The focus shifts. Population-level fertility control, like those vaccines, becomes a viable, maybe even preferred tool. It's about managing the group, not necessarily saving every individual's fertility.
Makes sense. Different goals, different approaches.
But despite those differences in intervention focus, some prevention strategies are universal and crucial for both groups. Things like good biosecurity to limit disease spread, ensuring balanced nutrition appropriate for the species, and optimizing breeding management practices, whether it's timing mating in camels or managing habitat for deer.
And what an incredible deep dive this has been. Seriously complex stuff. We've gone from, microscopic pathogens all the way up to global environmental factors. It really highlights the crucial need for accurate diagnosis you have to know what you're dealing with, and then targeted intervention, whether that's treating one animal or managing a whole population.
It's a testament to how intricate life is, isn't it, when something as fundamental as reproduction gets disrupted. It really encourages us all, I think, to appreciate that delicate balance of reproductive health in nature and its far-reaching consequences, both for the animals we manage closely and for those in the wild. It all connects.
It really does. Every piece matters. So here's a final thought to leave you with. Given these rising challenges we all see, environmental change, habitat loss, what further implications might these insights into animal infertility have for the future survival, maybe, of both wild and domesticated species? Something to think about.
A big question indeed.
Thank you for joining us on this deep dive today. We hope you feel a little more well-informed.